One of the other things that we're talking about in this session is more broad patient experience and ways that we can improve the care and just experience of CLL patients more generally. So Leukemia Care ran a survey which we call the Living with Leukemia project, which was a survey of over 4,000 patients. The largest group was CLL, but it included all different types of leukemia. And one of the things that's really interesting about this is it allows us to compare between different types of leukemia and look where issues may be more prevalent for some leukemia types than they are for others. This project was run as a follow-up to the NHS England Cancer Patient Experience Survey and enabled us to look at differences between the traditional average NHS patient who's responded to CPES and those who may be supported by patient groups. And we get the age-old question about whether or not patients who have been in contact with patient organisations actually reflect the usual patient. The two biggest issues and findings we found in CLL, the first one was around watch and wait. So watch and wait, we found various issues there in terms of a lack of information provision. And one of the strongest findings was the link between people being far more worried or concerned if the information they received about watch and wait was not clear. So we found that not everyone was receiving written information about watch and wait. Some were just getting an oral explanation, despite the fact that in the UK there are a variety of different materials on watch and wait that could and should be given to every single person when an explanation is being made, so they can take that information away and digest it later. And one of the things that was really interesting was we found someone who was given a good and understandable explanation. When you compared those to people who were not given any information, they were 3 times more likely to be worried and concerned. When you compared it to those who were given information but found it difficult to understand, they were 5 times as likely to be worried and concerned as those who were given a good explanation. So it really goes to show that a bit of information explained badly is actually worse than having received none at all. And it shows how important it is to make sure that patients have access to good and understandable explanations, and also access to people such as patient organisations when they have further questions about this. The second key finding we found was around nurses. So data from the NHS England CPES survey has shown us for a long time that a clinical nurse specialist is one of the single biggest drivers of positive patient experience. They're worth their weight in gold. Leukemia Care have done campaigns about this, such as the My CNS Matters campaign. But we know they're chronically underfunded and we don't have enough of these CNSs. The NHS England Cancer Strategy for 2015 to 2020 recommended that every single cancer patients had access to a clinical nurse specialist. Unfortunately, that in practice is not the case, despite that period obviously now being elapsed in 2021. And in Leukemia Care's survey back in 2017, one of the things we looked at as what was the uptake of CNSs for patients at that time, and we see a huge difference between different types of leukemia. So in the acute leukemia types, over 70% were reporting they had access to a clinical nurse specialist. But when you look at CLL, that falls significantly, and it was, I believe, 56% who reported they had access at all stages. But most concerningly was that was over 60% for people who started treatment straight away at diagnosis. But for those who were on watch and wait and still on watch and wait, at the time of the survey, only 29% reported they had access to a clinical nurse specialist, which, given that's one of the single biggest sources of information for patients, the person as a key point of contact you can go to for questions, and such a big driver of positive patient experience, is simply unacceptable. Clinical nurse specialists are so wonderful and matter so much, and we need to make sure that all patients have access to one and know how and when to contact them in the source of questions and needs for clarification.